This is Med School Radio. We're looking at the most likely topics you'll see on the USMLE. Yes, we are back with yet another segment. This time we're going to talk about a little bit of biochemistry, and I'm just simplifying these down so we get the main points here. So this time we're going to talk about fructose metabolism, and we're basically going to touch on 2 points. One is essential fructosuria, which is a benign condition, and the next is hereditary fructose intolerance. So what's the difference here, and what is missing here? What enzymes are missing for each? I'm just going to tell you right away what they are. For essential fructosuria, which is benign, the problem is going to be with fructokinase. And for hereditary fructose intolerance, it's going to be a problem with aldolase B. So I just skipped to the end of the movie and told you what the end is, but I'm going to just give a little bit more detail. So you might see a patient that comes to you and everything seems okay, but when you are looking at the urine, they have a positive copper reduction test. And this means that one of the enzymes is missing. And the enzyme that's missing here is fructokinase. And this means they have essential fructosuria, which is benign. So, okay, big deal. What does that mean? Well, this is a benign disorder, and it means that they are essentially, they're not metabolizing the fructose. But one other disorder, an intolerance, which would be much worse, is hereditary fructose intolerance. And with this, you'd have hypoglycemia, your sugar would drop quickly, and you'd start vomiting after any time you had ingested fructose. And this would cause you to have problems with survival, and you'd end up with renal failure and possibly liver failure. Now, so remember this, for hereditary fructose intolerance, there's a problem with aldolase B. And for essential fructosuria, the problem is with fructokinase. So are you ready for your big test? We have to choose between fructokinase and aldolase B. Okay, I'm going to say the name of the condition. You're going to guess which enzyme is deficient. Okay. Essential fructosuria, which is benign. Is it fructokinase or aldolase B? Okay, the problem here is with fructokinase. So obviously, aldolase B is the problem with hereditary fructose intolerance. So remember those, and if you have a question that comes up, which is asking which enzyme is deficient in this problem with fructose metabolism, you might have a good chance at getting it right. This is Med School Radio.